Health leaders say more young adults and women are getting liver transplants. Denver7's Wanya Reese is looking at some solutions out there to try to help keep young people and those facing alcohol abuse safer.
We're at Tepeyac Community Health Center. We are a federally qualified health center, which means that we provide primary care. We serve a wide area of Denver.
In the Elaria Swansea neighborhood, you'll find this medical space.
Yeah, I do a couple of different types of work. I'm a family doctor. That's most of my work. So that's primary care.
Dr. Patrick Huffer works with those battling addiction, which he says impacts people from all walks of life.
In health, and it's not just in this neighborhood, this state or city.
And Huffer is not alone. John Rice, a transplant hepatologist at UC Health, says during the COVID-19 pandemic, 60% of people increased their alcohol consumption.
The number one reason that we transplant people, and a lot of that is driven by alcoholic hepatitis, this acute inflammatory issue from overconsumption over a shorter period, sometimes just years. And that's why we're seeing a lot more young people who are developing this. And women have been kind of the two groups that have been really kind of affected by this.
Rice and Dr. Huffer shared some ways to get ahead of it to lessen your chances of ending up on a transplant list.
Really, it comes down to identifying people early with alcohol use disorder. And there's questions we can ask. There's certain things that primary care doctors can do, or even by the time they get to us, hopefully we can identify people that have alcohol use disorder as driving their liver disease.
One of the best ways is to listen to that internal compass that says, I might have a problem, or sometimes it's not the internal compass, but other people saying, you have a problem.
Dr. Huffer says doctors can treat alcohol addiction through things like therapy, medications, and more. Reporting in Denver, I'm Wanya Reese, Denver7.